Pregnant women, stop wasting your money going for a scan many times during pregnancy. You have spent so much money where you are going for scan almost every month in one particular pregnancy. See, you only have 3 important times to go for a scan, and I will tell you when to go for this scan. The only thing that can increase the number of time you go for this scan is only when your midwife or your doctor requested for an extra scan. Maybe you had an issue, or maybe they suspected something is not going on right. They now ask you to go for another scan. But aside from this, you only have 3 times to go for a scan. Another thing that can increase this number of time is maybe some hospital, they make it as a routine that each time you come for an antenatal, they will request you go for an ultrasound scan. They have their reasons. But I tell you, you only have 3 important times to go for an ultrasound scan. And the first one is during your first trimester, the first 3 months of your pregnancy, within 8th to 12th week. The reason why you're going for this particular scan is, one, to ensure that you are carrying a healthy pregnancy, a baby. You know, sometimes women will be pregnant and they are carrying an empty sac. No baby will be formed inside the sac. The first scan will detect if you are carrying a baby inside that sac, because when it is an empty sac, it's possibly you may end up losing that pregnancy. Another reason for the first scan is to rule out ectopic pregnancy. Some women may be pregnant, but their baby is not growing inside the womb. Once you fall pregnant, at some week, your baby is supposed to start growing inside the womb. But if the baby is growing anywhere outside the womb, maybe the fallopian tube or your ovary, or even in the abdomen, anywhere outside the womb, this is an ectopic pregnancy and is considered an abnormal pregnancy, which you don't supposed to carry that pregnancy further. So this is the reason why you should go for this first scan. The second scan comes within your second trimester. This time around, there are so many things again that you're supposed to look out for. And the right time to go for this scan is when you attain 20 to 24 week. This scan, we normally call it anomaly scan, because they tend to rule out any abnormality in a baby. So if you are carrying a baby that have some abnormality or some challenge that will affect them later in life, this is the time that they will detect this kind of condition in your baby. And aside from this anomaly scan, this scan can also detect the status of your pregnancy, if your baby is growing well, or if there is anything that is restricting that pregnancy from growing well. This scan can also detect it. So, and again, this scan can also tell you the gender you are carrying. This is the perfect time to go for gender reveal, because this scan normally tells the gender you are carrying. So this is the reasons why you go for this second scan. Then the third scan should come when you reach your 3rd trimester. The perfect time to go for this scan is within 32 to 35 weeks. This can also have so many things to look out for. The first thing is the weight of your baby, because when your baby is found out to be of a high weight, they may start suggesting other methods you will use to deliver that baby. Aside from this, the position your baby is adopting. If your baby is not maintaining a good position that is suitable for a natural birth, they may start suggesting other means of delivery. Another reason why you should go for this 3rd scan is to note the status of your placenta. If your placenta is not in the normal position or situation, there is what we call placenta previa. This is a situation whereby your placenta is covering the mouth of your womb. If you have any of this placenta previa, possibly you may not deliver your baby using natural birth. Your means of delivering that baby may be through cesarean section. So these are the reasons why you should go for this 3rd scan. So aside from all those things I have listed here, there may be other need for you to go for a scan, but this time around it should be your doctor or your midwife that should request for that particular scan. So if you don't have any issue with all this, you just need 3 times to go for your scan. So from now, stop wasting your money going for scan almost every month when you are pregnant. Okay, I'm saving you your money. And don't forget, this is your favorite midwife. I'm always here for you. And remember, I have an upcoming class that as a pregnant woman or as a woman planning to get pregnant, don't fail to register in that class, because there's so much you are going to discuss in that class which you don't supposed to miss. All right, this is your favorite midwife, Joy aka Ilediagu. Enjoy yourself and see you on our next video. Thank you.